Hey everybody, my name is Carissa Lackey, and I'm going to be talking to you today about dengue fever. Dengue is a mosquito-borne viral infection that originally emerged in the 1950s. It can be asymptomatic or it can cause flu-like illness. It's endemic in tropical and subtropical areas, especially Southeast Asia, the Western Pacific Islands, Latin America, and the Caribbean. This puts half of the world's population at risk of contracting dengue. About 400 million people are infected each year, and about 96 million actually become ill. There are 4 different serotypes or versions of the virus, so recovery from one of those serotypes will lead to lifelong immunity against that one serotype, but not against the other 3. It is transmitted by the Aedes aegypti mosquito, which is the same mosquito that transmits chikungunya, yellow fever, and Zika virus. After the mosquito bites an infected person, it takes about 4 to 10 days for the virus to incubate within the mosquito. During this time, the virus is replicating and then making its way to the salivary glands. Once it reaches the salivary glands, it is able to be passed to any other people that the mosquito bites during the rest of its lifetime, which can be up to a month. It is a daytime feeder, particularly in the early morning and the evening before dusk. Aedes albopictus is a secondary vector, and it's more common in Asia and Europe. Patients can transmit the infection to mosquitoes for about 4 to 5 days on average, but up to 12 days. The virus can only be transmitted to and from mosquitoes. It cannot be transmitted directly from person to person. Symptoms include high fever, headaches, pain behind the eyes, swollen glands, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash, mild bleeding, including easy bruising. Those who've never had the infection and young children tend to have milder cases of dengue, but those who have had the infection before are more likely to contract dengue hemorrhagic fever or severe dengue. This is due to damage of the blood vessels, which allows them to be leaky, as well as a drop in platelet count. It can cause bleeding from nose and gums, as well as enlarged liver and circulatory system failure. It can progress to massive bleeding, shock, and death, which is called dengue shock syndrome. Dengue should be suspected if a person has a high fever accompanied by any of the 2 symptoms that I specified earlier. And diagnosis is through antibody tests or through molecular testing. Antibody tests are more common and can show if the infection is happening at that time or was recent or in the past, depending on the different levels of antibodies that the test shows. Molecular testing is through polymerase chain reaction and is not as common because it's not available everywhere. And in this case, it's actually looking for the viral DNA within the blood, as opposed to the antibody tests, which are looking for antibodies that the body is making in response to the virus. There is no treatment for dengue fever, but dengue hemorrhagic fever should be treated through medical care, especially through maintenance and control of body fluid volume. Medical care does decrease mortality rate from 20% to under 1%, so it is important to seek out care during this time. High-risk groups include those living in tropical or subtropical areas, especially those with weakened immune systems and those who are older. Children and teens are less likely to experience symptoms, even during a mild case of dengue fever. Because there is no treatment, prevention is very important, especially by preventing mosquitoes from propagating in the first place. This can be done by getting rid of stagnant water, especially any that's sitting around in any garbage that's just lying around. Also through fogging, which will kill any mosquitoes in the area. And then you can avoid bites by using mosquito netting when possible. There is also a dengue vaccine that has been available since late 2015, early 2016, and there are more vaccines that are still being designed but are not yet in circulation. That's all I have for you today. Thanks so much for listening in.